Hi, this is Yohei Takada from Funcphysio Physical Therapy in New York. Today we'd like to talk about visceral mobilization. What about it? Lots of people have some kind of intestinal or digestive issue going on and doesn't realize it is related to actual mobility of visceral, like intestine and stomach. Uh, you know, People doesn't know about what made of intestine and stomach and large intestine kind of stuff. It is actually muscle. It's called smooth muscle. It is different from what we call the skeletal muscle like biceps, quadriceps, and hamstring. It is different type of muscle, yet it's same muscular tissue, so that it get tighter, it gets stiffer, and losing mobility. So, re-establishing those healthy contraction and expansion is helpful to help the function of digestive system. If you have an issue, it is important to talk to a doctor about how digestive system works, like a number, like blood work, etc. So like somebody is saying going to the doctor, having let's say heartburn, constipation, and still not get resolved by the pill, and or you go to the doctor and you have to take like 3 medication for the rest of your life. You may think about, okay, well, is that only solution? It may be solution is more simple, re-establishing those mobility of visceral organ. We're going to talk about self-management of visceral mobilization. You have to go to specific physical therapist or somebody able to do that kind of mobilization technique on you, like specifically like have to work. But you can do your own like a very general like mobilization. I'm wearing a clothes. Typically, I'm like, if I'm treating my client, it's hands on the skin or like a very thin clothes. I'm wearing the clothes because of the video purpose, and then I'm standing. Typically, it's better to treat in the foot line, like semi-supine position, like pictures. Standing, you have to have like some kind of abdominal muscle activity going on, which is not ideal. Foot line position is, typically your muscle is relaxed. You can access to a lot of the organs, so which is better. Having said that, let's try do it. First of all, you have to relax your stomach. A lot of people think like, oh, tight stomach is a good core. It's not. The muscle has to work when it works, and what muscle has to relax when it relax. So like all the time, like tight muscle, like, oh, look at it, my abdominal stomach is tight, good core muscle. It's not. Just don't mistake about it. Somebody has good motor control, somebody very athletic, is typically really loose stomach muscle when it relax. When it's tight, of course it's tight, but that's like a good function. I typically start very general mobilization, like using my hand or like palm, like going back and forth, like side to side, how my stomach is relaxing and moving. It's not specific how my stomach is pushing away from, like now it's left to right. How about right to left? Right? It's how it's moving. It should be like squishy, shouldn't be like there's no tightness. It's very squishy, it's mobile, and up and down, okay? And just relax your stomach as much as you can. And there might be like you feel like, oh, this is maybe a little bit tender. If you have like gentle pressure just moving around their organs and feels like a tension or some like discomfort, there might be like a tightness around the tissue. Could be the fascia system, could be organ itself, or could be like muscular system, like a smooth muscle as I talked about it before. Up and down. This could be good massage. You can do just left, right, maybe like diagonal, okay, and find like let's say like, okay, this is like something is a little bit tighter than other way. Focus on that. Maybe you can just like, make a circle, gentle push. Maybe like you can breathe in, breathe out. Think about as like a skeletal muscle. Try to massage out. Okay. And also stretch, keep the gentle stretch and keep breathing. Those fascia muscle will let it go. Okay. Now, there is a rectus abdominis. Lots of people say six-pack muscle. A six-pack muscle has to be relaxed most of the time, and it has to be really mobile when you push away or push in. So like check it. Is it mobile? Right, side to side. Is it mobile? No tension or no pain. It shouldn't be painful. And it's very like a thin, like a sheet type of muscle. So it's not. You don't need to like dig it in. It's very superficial. Okay. Same thing. If you feel a tightness in like one way or other, just focus on that. Keep sustain the pressure and breathe. A lot of time, this muscle let it go. Good. Okay. And next step, I like to do a long rib cage. Muscle attach and also abdominal content is underneath of the rib cage here. Okay, so I like to move a long rib cage. You can just a little bit hook into the rib cage. It might be painful a little bit, but shouldn't be painful if muscle is relaxed and flexible, organ is relaxed and flexible. It shouldn't be painful. I typically go sustained pressure, breathe in, breathe out. You can just gently like a side to side muscle. Try to hook into the rib cage. It's not that much pressure, it's very gentle pressure. And if you're like very like mobile, like functional abdominal muscle and also organs, it shouldn't take that much pressure. It's very gentle. Okay. And again, there is a tightness, focus on that spot. It could be tightness to in or tightness in. And also there is a process here. And left side of it, there is the esophagus coming down to the stomach. So that is also important. Somebody has also the GERD. Those stomach arches is going back to the esophagus, which typically, very uncomfortable. And if your tightness around here, those sphincter is affected. So make sure you massage out, make it smooth, make it loose, so that the sphincter can function well. And same thing with the right side, okay? And lastly, I end up with like circle massage. And make sure go through direction of the large intestine. So large intestine starts from right lower corner, go up, cross, and going down to the left bottom, and become sigmoid colon. So it's important to just go with flow. Don't go against it. So like you can just gentle like circular motion from here, right? It's like clockwise basically. Yeah, it's a gentle pressure. And relax your stomach. Yep, and go up and cross. And go down to left lower side. Okay. And maybe you can go to the sigmoid colon. Maybe that's enough. Okay. Well, this is a very basic general like a visceral massage. If you have a specific issue, like specific site, like sphincter is tight, specific organ is tight, you better to see somebody specialized in visceral mobilization so that they can release, like identify where it's tight and then how release those tightness so that you can gain the regain the mobility of organs. Hopefully this help your issue such as constipation, GERD, discomfort in digestive system. Please let us know if you have any questions.